everybody, and welcome to the opening day of this special medical webinar series presented by the IHF Education Centre. My name is Courtney Gahan, and I'm the moderator for this session today. To begin, I will outline the translation options we have available today. We have French, Spanish, and Arabic translation available if you are joining us on Zoom. You can find these at the bottom of your screen by clicking the globe icon marked interpretation and selecting the label for your language. Today's lecture marks the opening of a medical webinar series that is going to run weekly through to and including December, focused on various handball-related topics within medicine and sports medicine. All of this falls under the umbrella of the IHF Education Centre, available at ihfeducation.ihf.info. All of these sessions are being recorded, so you will be able to access them on the IHF Education Centre at a later date for on-demand viewing. This is also the first program forming part of the Virtual Academy, where we will offer a certificate for participation. This applies if you participate in all the lectures, and to receive this certificate, we need your contact information. So we ask you to share your full name and your email address with us in the chat function so that we can collect those and be ready to send you the certificate. Today's lecture focuses on the role of the team doctor and medical assessment of players, and is presented by Dr. Michiko Dohi, Deputy Department Director of the Sports Medical Center, the Japan Institute of Sports Sciences. Before Dr. Dohi speaks, we will also hear from IHF President Dr. Hassan Mustafa and Dr. Hosni, Chair IHF Anti-Doping Unit Chairman. So we will begin first with a short video. And now we will have some opening words from IHF President Dr. Hassan Mustafa.
Thank you so much, and good afternoon for everybody. And I'm very happy to be with you today to attend together this very important theme for us in this very difficult time for all sports, not only for handball. But let me also starting with give my gratitude to Professor Hosni Abdurrahman, and also that all this working groups that are working with us now to take care of health of our players. And this is also, I want to confirm some things is very important for all of us, that the purpose of this medical course is to provide education of sport medicine across our member federations and support them to stay active in our sport while managing health. Health is the key element to be able to promote our sports, as without healthy athletes, handball would not exist. Keeping our players healthy in the basis for a bright futures of our sports. During this difficult time, it's even more important to increase the IHF attention to our health of our players and trainers, referee, manager. Means all handball family is very important for us in this very difficult time. Starting from 2021, the International Handball Federation increased the rest days at the World Championships, starting from Egypt, means next January 2021. And we also increasing the number of the players on the square left to 18 instead of 16. For the World Championship in Egypt, we also increase this number further to 20 players, meaning to give coaches bigger selections of players so that can prevent it and the athletes keep healthy. In addition, the IHF formed a COVID-19 medical task force which prepared the medical precaution plan that shall be implemented at IHF events, trying to minimize to risk of the infections, hopefully to zero. During the difficult time, the medical physicians of the teams play a very important role, and we hope that many of you have joined today, as the team physicians are a big part of this lecture. I would like to ask the team's physicians to work closely with the IHF Medical Commission and exchange relevant information and concerns. It's important to work together to prevent injuries as well as infections which may affect our sport in negative way. And as you know very well that we in this time, we as International Handball Federation, either we postpone some event or close some event, not only for handball, but for all the sports. And this is we don't know exactly where we are going now, but at the meantime for us that we have to adapt ourselves for the new situation with this COVID-19. And we have also to study before and during and after. But the main time for us, we can to close our activities, but we have to work together in these directions to avoid any problem for from our handball family. I hope very good luck for this course. And I hope also that we can provide us with some advice that we can use it in the future, starting from our Men's World Championship 2021 in Egypt. Thank you so much and very good luck. Thanks for the working group as headed by Dr. Abdurrahman and also the rest of the members. Thank you so much and very good luck. Good day. Bye.
Thank you, Dr. Mustafa. Now we move to Dr. Hosni for his opening words.
Yes, hello. How are you, everyone? Congratulations that we are succeeded to conduct the first medical refreshment course for IHF. Second one. Okay, second one. Yes. IHF decided to conduct medical course for handball and for national team physician worldwide in general, and target for the 32 team physicians qualified for Egypt 21, 27th men handball January World Championship. Yes, next. The main objective of the course: refresh and update the medical knowledge of team physicians and the physiotherapist. Overview the latest advances in the sport medicine topics related to participation in handball. Proper selection and importance of medical examination of all the players. Study the recent advances in the post-injury rehabilitation of handball players. Okay? Second one. It is very important to every team physician to know mental health and the proper psychological assessment of handball player and referee. Also, effect of proper balanced nutrition on performance and for high the endurance of the player. Also, we're facing on January the new WADA, new code 21. Every team physician and the coaches and all administrators must know something about TUE, latest prohibited drug list, which will be started from January 21 in action. Yes, second one. IHF select high scientific professor in the area of sport medicine, and all of them with experience in the handball medicine. I hope all my colleagues in team physicians, physiotherapists to register in this course. Also welcome to handball referee and anyone in sport family and in sport medicine. Next one. I would like to thank all my distinguished professors and doctors for their accepting to contribute in conducting this very valuable course. Also, thanks especially for the President, IHF President Dr. Hassan Mustafa, and Council Member Mr. Dietrich Speth, and IHF General Director Mrs. Amal Khalifa, and all my colleagues in IHF office and my groups sharing and conducting this course for their effort during the preparation of the course. A special thanks and gratitude to my friend Mr. Komiaki, the main administrator of this course, with his valuable effort. Thank you very much. I hope everyone, for our colleagues and team physicians, to enjoy and to have feedback with a high scientific feedback for everyone. And we remind you, at least 95% of attending this course IHF will be submitted a certificate at the end of the course, and the president of IHF will be distributed through the World Cup Championship in Egypt. And thank you very much. Well, you have a good effort and a good benefit from this course. Bye-bye, and see you in the end of the course in the 18th of December 22. Thank you very much. Bye-bye.
Thank you, Dr. Hosni.
Thank you, Jahan. How are you?
So we are ready to begin with the lecture now. And just a reminder that you please feel free to send questions throughout, especially today as we were asking you to share your name and email address if you would like the certificate in the chat. Please try to put your questions in the Q&A function, as that will help us to sort through all the information coming in. So Dr. Dohi, we are ready for you to begin.
Corny.
Yes. Yes.
And I want to speak about some about Michiko. This Michiko is our colleagues in FIFA and the AFC and the Japan Football Association Medical Committee. She is in FIMS Medical Committee, and she is working as team physician since more than 25 years. That is why her lecture today about the role of team physician and assessment of the player will give not only from scientists, but for well-experienced one working as team physician for a long time. I hope everyone will enjoy and have benefit from this. Thank you very much.
Thank you, Doctor.
Thank you, Hosni, for your introduction about me. So, shall I start? Okay. Hi, everybody. My name is Michiko Dohi from Japan. I'm working in Sports Medical Center, Japan Institute of Sports Sciences in Tokyo. So I'm so happy to involved in the first IHF medical course as first speaker and shared my experience with you. Today I'm talking about the role of team physician and the medical assessment of players. But before that, I would love to introduce myself a little bit. I'm a sports physician for 30 years and I have 26 years of experience as a team doctor. Fortunately, I have opportunity to work as 3 types of sports doctors. One is team doctors, mainly for Japanese national men's and women's football team and Japanese Olympic team. And the second one is the medical officer in international tournament. And the third one, committee member in international sports organization, FIFA and IOC. In nearly 30 years of the experience as a sports doctors, what I learned is that the role of sports medicine, sports doctors, has changed dramatically from 30 years ago. Nowadays, demand on sports doctors are very high, not only medical matter, but also legal matter, such as doping, human rights, confidentiality. It means the responsibility of team doctor has become heavier than before. So today, I would like to talk about what happened in the field rather than in the textbook of sports physician based on my practical experience. I'm not the researcher, just I'm practitioner. So I love to share my experience with you. So today's topics are what is sports medicine, role of sports doctors, prevention of injury and illness, and medical assessment. So of course we are doctors, so we care of the injury and illness of the players, athlete. But now we are switching to the preventive medicine from care, because the loss of withdrawal due to the injury or illness of players is huge for the team and the players. Can you imagine how much salary top footballer, professional footballer, and major leaguer and professional tennis players, how much get for 1 week? Maybe more than our salary per year. So you can imagine the big loss if the players get injury or illness and out of the play. And now it's not meaningful to participate in competition, but how to match the peak of their performance to the competition is becoming important. We're talking their performance. We are talking a lot about condition which are related to nutrition, rehabilitation, training, special concern of junior and female athletes, acclimatization on an environment, mental conditions, so on. So you can see sports medicine is now multidisciplinary medicine. It means you need to know widely about sports medicine at least. In terms of role of sports doctors, so of course, you doctor spend a lot of time in the hospital or clinic where your position might be center. But if you come to the team, you are just one of staff. So your position is totally different to in the hospital. So please remember this and behave professionally. Don't be too much close to the coach or players, not deeply involved in strategy. Please be natural. This is my suggestion if you want to succeed as a team doctor. So role of sports doctors, of course, injury management, illness management, prevention of injury and illness, emergency care, deal acclimatization issues, travel medicine, such as jet lag or time differences, and problem heat and humidity and altitude, optimizing performance, including nutrition, hydration, take off the overtraining, of course, anti-doping issues, and then counseling player and staff. A huge job. So injury management is main role of the sports physician to determine that player is injured. And of course, you have to make diagnosis and you have to judge if you send the player to the hospital or you take out these players by yourself. And you should be heading the rehabilitation team. And the most important things, to notify the coaching staff of the injury and the expecting time for return to play. Actually, coaching staff interesting, not so much in diagnosis, but they are interesting. This player can play next game or in 2 days or in 1 week and 1 month. So for them, expected time for return to play is most important. So we have to judge how long does it take to treat their injury. About illness management, almost same things. We have to make a diagnosis and treat illness and then notify the coaching staff about illness and expected time for return to play. In the practice, mainly sports doctor take care of acute disease such as asthma attack, infectious disease, diarrhea, rather than chronic diseases, which can be controlled before competition. In my impression, coaching staff and player underestimated their illness more than their injury. I think because they can run, throw ball, kick a ball, even here they are sick, but when they got injured, they cannot run, they cannot throw ball, they cannot kick a ball, so they take the injuries more serious than illness. But for example, influenza, which has high infectivity, it required 4 or 6 weeks to recover to original condition. So if player return to play too early, their condition might be getting worse. So we have to educate the coach and then players the take the illness seriously. So as mentioned before, now sports medicine switching to the preventive medicine. So prevention of injury and illness is very important in the sports medicine. But how to prevent injury and illness? So that we have to know what, why, where, when, how injury and illness occurs. And we have to know the risk of injury and illness. Injury and illness surveillance and epidemiological studies are fundamental elements of concerted effort building block for sports injury, illness prevention programs to protect the health of the players. This is the this slide shows that framework for management the risk of injuries. So epidemiological study of injuries allows to identify risk factor or estimate risk, and we evaluate in the risk. If the risk is acceptable, in this case, we communicate information to the sports community. If not acceptable, so we try to reduce the risk using preventive intervention and the therapeutic intervention. Yeah. So epidemiological studies of injuries are employed to define baseline levels of risk amongst players, to identify the risk factor and to investigate the effectiveness of injury prevention strategy on the incidence and nature of injury, to reduce the incidence of minimizing the short and long-term consequences of acute and overuse injuries is based on the principle of risk management. Identify risk factor, estimate the risk, and evaluate the risk are referred to collectively as risk assessment. These risk factors are subdivided into the extrinsic and intrinsic factors. Intrinsic risk factors including issues that are specially related to the players, such as gender, age, body mass, joint range of motion, and flexibility. Extrinsic risk factors such as law of the game, effectiveness of protective equipment, design of sports boots, condition of playing surface, Understanding which, how, and why risk factor can have a significant impact on the incidence and nature of injury amongst different groups of players is the first stage in developing effective injury prevention program. So preventive interventions, these approaches are primarily aimed at reducing the incidence of injury. Also, they may also have the beneficial effect on severity of injuries. Preventive interventions, including changing the law of the game, changing the player's behavior to the one of fair play, and ensuring that playing surfaces have been inspected and cleared of dangerous matters prior to start of play. Therapeutic interventions, these approaches are aimed at reducing the consequences of players' injuries. Many sports physicians and surgeons working within sport have developed new techniques to improve the assessment, treatment, and repair of injuries. Research other specialists have developed innovative injury rehabilitation programs that reduce the time away from play and or the number of re-injuries sustained by players. And this exchange of information enable all stakeholders in sports, in our case handball, to engage informed database about injury prevention, treatment, and rehabilitation, which benefit the health of all players. So we understand the epidemiological data is important to prevent injury or illness or reduce the risk, but how to collect the epidemiological data? So FIFA, in my case, FIFA Football Federation that started 1998, then collect the injury report during World Cup. And also IOC collect the similar data during Olympic game. And now IOC International Olympic Committee consensus statement have just been published in British Journal Sports Medicine, how to method and reporting of epidemiological data or injury and illness in sport 2020. So please have a look this study article so you understand how to collect the data. It is a bit not simple, a bit complicated, but it is very important things to collect the data. Also, the during Olympic Games, the IOC collect injury and illness data, and during Olympic Games. So these studies published in the British Journal of Sports Medicine 2, you can find what kind of injury illness happened during Rio de Janeiro Olympic Summer Games. So I show that the top three of the affective system respiratory and gastrointestinal and dermatological system are the illness. So it's also in agreement from my experience. No matter where, when, which tournament take place, this affective system always the same. So how about handball? I pick up some graph from this study. This slide short a bit busy slide, but you can see the case of handball here. 6 cases of the illness has been reported. Not so much because total number of illness of the reported is 613. So maybe 1% of the incidents happen in the handball. And 1 case, a dental problem, 2 cases dermatological, and 1 is gastrointestinal. In your sports, there is no respiratory system, but it has urogenital gynecological problem to have 2 cases. And then this one, the injury mechanism is cause. So look at handball, 49 cases reported from 1,100 cases. Still not high, but the mechanism of the injury, contact with another athlete, 18 cases, and also the non-contact trauma, 40 cases. Should be ankle sprain or some ligament injury or so, I guess. So now you know what type of the illness or injury happened in your sport, and then you can find measure to prevent. And also this study mentioned that the nine concussion, one concussion from the handball. So now you have to know how to deal concussion. And also the handball had handball is sports with higher incidence in the competition than in training. In the fourth place, first one is boxing, second one tennis, hockey. Fifth place. So handball still have the higher incidence in competition than in training. So now you focus more in competition than in training. So now you know how to prevent the injury. So now move on the emergency case. Sudden cardiac arrest and death and traumatic brain injury, including concussion, acute subdural extradural hematoma, or neck injury, asthma attack, anaphylaxis, may be life-threatening injury and illness. Of course, we cannot prevent all cases. However, we can save some of them by proper medical assessment and emergency care. Care of sudden cardiac arrest and death, and brain injury, and neck injury, and concussion on the field are very crucial for both players and team doctors. You have to know how to do CPR, of course you know, and use AD, of course, and use backboard, yes, I hope, and judge concussion on the field. Everybody watching you from bench, from stand, on the TV. If you do it wrong, you may be in court. So you have a serious responsibility on the pitch. And please don't forget, prepare AD, backboard in the field, or you check ambulance and medical room, medical equipment when you arrive stadium, arena, or training places. So as I mentioned before, usually during a competition, during a game, we take care of the infectious disease, one of acute disease. So infectious disease may affect the player's performance. So we have to try to prevent infectious disease as much as possible. Of course, now you know that COVID-19 is spread out in the world, the same things, not so big difference other infectious disease and COVID-19. So hygiene, as you know, wear face masks to avoid splash, and then you wear proper clothes, avoiding mosquito bite or animal bite. Wash and sanitize hand, disinfect materials or sports equipment, isolate infected person quickly, and then ask the players not to share bottles, towels, so on. And against the infectious disease, we need a good immunological system. So to keep your immunological system good, so we need a good recovery, nutrition with balance, and sleep with high quality. Very, very basic things, but very, very important to good recovery and good immunological system. And if we can prevent infectious disease by vaccine, so we have to ask players have the vaccination. Unfortunately, COVID-19 vaccination still not appeared, but we are expecting the vaccination COVID-19 to restart the international competition or so on. So just I want to share my experience. I have camp abroad 2 weeks back, and I introduce what I have done as countermeasures for COVID-19. So our team, our football team, national men's teams, we have the camp in the Netherlands and have 2 friendly match. And of course, we prepared medical bag as usual, but this time I added some items. So rapid immunochromatographic test kit for detection of antigen of COVID-19 if the player has a symptom, and then added gown, glove, goggles, medications. And we have done COVID-19 test before departure within 72 hours prior to departure. And of course, we have conducted COVID-19 PCR test on site according to regulation, local regulation or European regulation. We have done twice, 72 hours before game. And we have collected samples on site. And then, of course, if the players get COVID-19 and then symptom is a symptom, or if the symptom is light, we can treat them. But if the players needed hospitalization, so we cannot do ourselves. So now before go to the abroad, I try to find the local doctor and hospital. Luckily, I know the one Netherlands doctors. I call him and then ask his support, and then he introduced me the university hospital just in case near our hotel. Luckily, we didn't have any patient of COVID-19, but preparation is very important. And of course, we have done health check, the body temperature, and they always ask the symptom related to the COVID-19. And also we ask the player and staff to wearing mask. And then we have the restriction in the restaurant. Now we use the one table for one players and having enough distance, and we distribute disinfectant spray. Every time when eat, they have to use sanitize hand, so and so. And then we limited the number of the player in the medical room, in the bath and dressing room. And this time we cancel the relaxation room and ice bath, or we ask the players not share bottles. So it was not easy, but we can find a solution and we can do the camp and or international games. So, but we need to be patient. We need to educate the player and the coaching staff to how to deal, how to keep hygiene, how to prevent from COVID-19. So now I move on to the medical assessment. So why we need medical assessment? The answer is simple, because we have to protect players from injury, illness, and doping violation. When? Ideally, just before season or competition, but we don't want to disturb the players' match schedule or training schedule. But if possible, it's better to have medical assessment just before season or competition. So what's content of a medical assessment? Medical inquiry, internal medicine, orthopedic, and dentistry. We, of course, sports physicians and players are very interested in illness or injury, but sometimes we neglect the medical check of teeth. Teeth very small, but it has a big problem when player has a problem of the teeth during a competition, because they cannot eat cannot eat properly because of the pain or some problem of the bite, or sometimes they cannot stand formally because of the toothache. So don't forget to check their teeth. So medical inquiry is very important because personal and family history associated with critical cardiovascular disease. If we know, we can prevent sudden cardiac arrest or death. And we know ingestion, state of medication and supplement of players, we can prevent doping violation if they take prohibited substances. If we know their gynecological problem, we can prevent deterioration of conditions by due to menstruation. So medical injuries is important. So internal medicine consists chest X-ray, cardiac examination, and pulmonary function test, blood urine test, and if possible, or if you have time, if you can, the SCAT-5, the Sports Concussion Assessment Tool 5, conducted for as a baseline for concussion. As mentioned before, because you have to take care of a concussion case, but the healing process, we want to know the estimate their condition of concussion, better or worse or stable or does it change. So to judge of the severity or outcome of concussion, we need some test. So for that, if you can, you know the score at the baseline, so it helps to judge the severity and then outcome of concussion. And also the important examination is cardiac examination. To avoid sudden cardiac arrest and death, we need this cardiac examination. Very, very important. Personal and family history. Of course, the cardiac problem is genetic disorder, so we can find out the cases of the cardiac problem, and then present and past complaints like a syncope and chest pain, palpitation, or shortness of breath. These symptoms suspected heart diseases, heart problem. And physical examination, also important. For example, Marfan syndrome. As you know, this disease is genetic disorder that affects the connective tissues. With the condition, tend to tall and thin and with long arm, long leg, finger and toe. These physical characteristics are suited for the sometimes volleyball, basketball, could be handball. They also typically have overly flexible joint and scoliosis. The most serious complications involve the heart and aorta, with an increased risk of mitral valve prolapse and aortic aneurysm. Its causes, an aortic dissection, is most often fatal. So physical examination, sometimes some diseases has physical characteristic. And also, yes, auscultation, important, heart sound, heart murmur, and then travel lead resting ECG is very, very important. Very simple examination, but very important. If you look at the British Journal Sports Medicine, some research mention about international criteria for electrocardiographic interpretation in athlete consensus statement is very good article, so please refer to this article. And if we need, echocardiography and exercise tests should be conducted. So just I touch the asthma, including exercise induced asthma. So you can, as you know, the prevalence, asthma is very common disease, not only the normal population, but also in the athlete, because the prevalence in the Olympic athlete reached 8%, quite high. So maybe in your team, maybe handball team, maybe one person in the team might be asthma. It's very common chronic diseases. We concern asthma attack due to the air pollution in competition venues. I remember that 2008 Beijing Olympic Games, that time the air pollution is very high concern of the players, and then top men's, women's long distance runner, they canceled to participate the marathon due to the air pollution. And some medication for asthma prohibit substance of the doping. So we have to take care, pay attention to medication for the asthma. And of course, if they have the pulmonary malfunction, it may affect their performance. So we have to control the asthma with proper medication to avoid asthma attack during the competition. Gynecological issues are menstrual cyclical abnormality, deterioration conditioned by menstrual cycle, and then period control. These issues can be solved before competition and by proper medication, like such as pills. So we know the medical assessment is very important, but sometimes athletes, they don't consider medical assessment to be important for them, unfortunately, because I guess they believe that they are so stronger than the normal population. They don't be sick like this. So, and then they don't want waste the time to come have the medical assessment in some place. And also they are so busy, so and so. So, but if we get good collaboration from athlete, the moment of the medical assessment, we have to show them the benefit of the medical assessment. So if they can have the early detection and early intervention of disease or injury, of course, they can get early recovery. They can get they don't need it waste the time to return to play. So important things. And also they can prevent infectious diseases if they have a vaccination, yes. And if they get knowledge how to prevent infectious diseases, it's benefit for them. And if they know that their condition, problem of the nutrition, sleep, or other problem, or good or bad. So if they know that their condition, they can adjust or they can improve their condition as much as possible. And they can avoid doping violation if they take some medication supplement containing prohibited substances. And the other hand, of course, medical assessment has a benefit for the sports doctor yourselves. Of course, if we can detect the disease or injury, and we can treat earlier, and we can save time, and then it makes our job easier. And we know epidemiology. So as I mentioned before, if we know the epidemiology of injury, illness, we can prevent. And then medical assessment is educational tool for the athlete. So and also good opportunity to educate players about nutrition, about the injury, illness, and a good opportunity to know each other's doctor, trainer, players. Because for doctors, there is few time to spend with players compared to the trainer or coaching staff. And then as players doesn't come to see us, or unless they are sick or they get injured. So few chance to talk with them, with players. But medical assessment, they come to see you, see us. So good opportunity to educate them and give some knowledge and know each other. And then good opportunity to establish good relationship and then their trust. So medical assessment is very important to find out that there are problems, but also has a benefit for athletes and sports doctors. So in conclusion, role of sports doctor is protect player from injury, illness, doping violation is most important roles. And if we can prevent injury or illness, we must prevent. This is our job, important job. And then optimize their performance. Also, if we prepare properly several things in advance as much as possible, we can make it we can success to, their treatment or prevention during competition or training session. And then you have to work in the team as one of the team staff. So don't forget the sports doctor is different to the doctor in the hospital. And then please keep and respect professional and appropriate distance from player and staff. This is key to success as a sports doctor. Thank you very much for your attention while listening my presentation. That's all.
Thank you, Dr. Dohi. So we have a couple of questions, quite unrelated to each other. Somebody first asked about, as related to COVID-19, what about wearing masks while playing? Is there any positive impact or is this advisable? And what is the impact of this?
Oh, during the playing,
yes,
wearing a mask. Oh, I think it's the wearing a mask during playing exercise. It's not important. Because one reason is not now, but in summer, because the risk of the heat illness. And second, splash doesn't come out when they don't speak or then don't spell how to spell out.
Mm-hmm.
So I don't think there's high benefit of the wearing a mask during the playing. So it is my opinion. So during, even if you look at the football game, during the game, I haven't heard that players get COVID-19 during the playing. Mostly they get the COVID-19 during eating and drinking situation, not playing. So, and also I checked we have done the experiment of the splash. So it's just to blessing. No, we cannot find so many splash. When they speak out, yes, a little bit, but it depends on the individuals. Girls or ladies doesn't have big splash compared to the boy and men. So I think it's not important wearing a mask during a game or playing exercise.
Okay, and somebody else asked about high blood pressure in athletes. This person asked if you allow an athlete with high blood pressure to participate.
Okay. So if we can control the high blood pressure, and if we know the reason high blood pressure, I think it's not necessary we allow them to play the competition. But of course, if their players' blood pressure should be controlled.
Okay. And well, let's just explain that a little bit more. So by controlled, can we talk a bit about that? If you know that one of your athletes has high blood pressure, what is some advice you can give for people?
Wow. Okay, so first of all, we have to make a diagnosis why they have the blood pressure. If they have some problem or some tumor or some hiding the illness. So first of all, we have to make diagnosis why they have the blood pressure, and then we give the proper medication, and then yeah.
Okay. I just asked this because we have all different participants, and I think this question was from someone who was not a doctor, so I wanted to give some more information.
Yeah, but sometimes the adequate exercise can help to reduce blood pressure. It's some research show that the evidence. Yeah.
Okay, that is all the questions that we have. So I think you have explained very well everything. Thank you so much, Dr. Dohi. And thank you also to Dr. Hosni and Dr. Mustafa for their opening words today. So we will finish today here. And as mentioned at the start, we are back again next Tuesday at 2 p.m. Central European Time. And next week's talk is on verification of gender during women's competitions and hormonal variations in the menstrual cycle and performance in sports. And that is presented by Dr. Zakia Bartaghi, Director of the Tunisian National Anti-Doping Agency. And as mentioned at the start, also you will be able to find this lecture available on the IHF Education Center, ihfeducation.ihs.info. So we'll leave it there today. Thank you very much, everyone, for joining us. And thank you to our lecturer today. Goodbye, everybody.